please come on in. You can sit comfortably in this chair right in front of me. How are you feeling today? Alright, I have a few questions for you if you don't mind. Have you had any injuries lately? Alright. And what about any issues? Any medical health issues? Have you been experiencing any conditions lately? Alright, do you have any allergies? Okay, any vertigo, dizziness in the morning when you wake up? Got it. How often do you experience that? Alright. And what about some other symptoms, like any distortions with hearing, any complaints regarding your eyesight, your vision, the sense of smell? Okay, how would you rate them? Okay, got it. That's actually good. Alright. Just a second. Let me enter all this information. Okay, nice. And let's confirm a little bit of your personal data just to be sure. So, your name, please. Your last name. Your address. Good. And then what about your phone number? Yeah, just in case of emergency. Alright. Good. Well, let me put on my gloves. And I hope that you're ready for your cranial nerve exam. No, it's not gonna hurt, I promise. Alright, so let's start with checking your breath and heart rate, right? So could you please breathe in and out for me? I will tell you when, okay? So let's start. So please breathe in and breathe out slowly. Good, wonderful. Alright, yes, and I'm checking your lungs, don't worry. I'm sorry if the stethoscope is a little bit cold. Yeah, just the way it is. Alright, so now once again, could you please breathe in and out really slowly? Good. Okay, and now once again, breathe in and out. Okay, good. And now could you please turn around, turn your back on me? Okay. Once again, breathe in and out. Alright, and now could you please hold your breath for a second? Just breathe in and hold there, okay? Yeah, hold there. Okay, now I can breathe out. Okay, good. Right, wonderful. So I don't see any troubles with that. Your breath is just fine, and your heart works just fine as well. Good. Now I'd like to have a little bit of this external inspection just to see how your face and musculature and other stuff is working. Alright, so don't worry, it's not gonna hurt, it's not gonna be painful, I hope so. But in case it is, you will let me know, okay, right away. If you experience some pain or some unpleasant, uncomfortable feeling, just let me know, alright? Good. So I will touch you really, really gently if you let me. Alright, good. Okay. So, do you feel any pain when I'm pressing on your forehead? Just like that. Alright. Good. Good. Okay, now your temples. Any pain or any unpleasant feelings? Good. Okay, now cheekbones, your cheeks this way. By the way, do you feel like symmetric on both sides? Do you feel the same kind of pressure on both sides? Alright. Now your chin, tiny a little bit. How does it feel? Do you feel any pain in this area? Alright, good. Now I'm going down to your neck. Okay. Could you please swallow for me? Okay, and once again. Alright, great. Give me a second. I'll just put in some data regarding our exam. Okay, wonderful. Wow, we can proceed now to the next stage. So I suggest that we check your olfactory nerve first. And have you had any troubles, any difficulties with your sense of smell lately? At least the ones that you would know about? Okay, got it. Good, that sounds good so far. Well, so I want you to actually take a smell, take a sniff. Okay, so what does it smell like to you? Yeah, so this is some kind of an essence oil, you're right. Alright, yeah, it's definitely some kind of citrus, right? Yeah. Could you be more specific? Because this smell is quite distinctive. It's basically, yeah, mostly sour, right? So, lemon it is, right? Yeah, wonderful. Alright, good. Now, the next one. Okay, could you please smell it once again? Alright, good. Yeah, just take a smell, take a sniff, no hurry. I'm not gonna rush you, it's fine, take your time. Okay, good. So, what does it smell like to you? Let's try once again. Okay, again, please, I'm not rushing you, so you can smell it, you can think what it reminds you of. So, any idea? Some kind of fresh smell similar to mint, right? Yeah, it is similar, quite similar, but not exactly mint. So any other guesses, any other ideas what it could be? Eucalyptus. That's quite amazing. Good job. And now one more. So here it is. Another one. So would you please smell it? Yeah, again, there is no hurry. So take all the time you need. Alright, so what does it smell like to you? Yes, definitely, yeah. Some kind of tree, wood, but it's also quite a sweet smell. So, do you have any ideas on what it could be? Sandalwood. Amazing. That's actually quite cool because the smells were, some of them were quite basic, like lemon, but some of them like sandalwood, and the eucalyptus. They are not like the most common ones, right? So they're not as basic as mint or coffee, for example, or some berry fragrance. So yeah, that's quite impressive. Good job. Alright, and now I suggest that we can test your sense of taste right away, okay? Also, I have some testers again, and there will be some basic tastes, basic flavors like sweet, sour, salty, and something like a little bit kind of like spicy. Alright, so you would have to tell me which of them you can taste, you can feel on your tongue. Alright, so please open your mouth and say ah. You can stick out your tongue a tiny little bit so that it would be easier for me to actually put it there. Alright. Alright, so give me a second. Good, are you ready? Alright, amazing. Wait a second. I will just get rid of some excessive amount. We don't need as much, just a few drops. So 1, 2, and 3. Okay. So now take your time. Again, I'm not hurrying you up. There's no rush. So what does it taste like? What kind of taste is it? Okay, it's definitely something sweet. Decided to start with the most pleasant one. Alright. Now let's try another one. Okay, give me a sec. Alright, that's perfect. Now, okay, again, once again, please stick out your tongue a tiny little bit and say ah. Alright, there we go. And now add a little bit more. Okay, good. So, what kind of taste is it? Sour, right? Yeah. And another one. So once again, say ah. Yep, and a little bit more. Well, I guess that should be enough for you to actually decide on what it tastes like. So what's your final verdict? Okay. Sure, that was definitely like salty. Okay, good. Give me a second. Just enter. That was pretty good. It was pretty smooth. Alright, so now the favorite part of many patients of mine, the visual test. Usually consists of a few parts, like basically comprises different kinds of tests. Well, so let's start. Just don't worry, relax. As I said, you've been doing great so far, so I guess that there's nothing really confusing about visual test. For real, just relax and try to do your best, okay? Good. Well, so now first, could you please follow the light for me, okay? Just follow the light. As I said, there's nothing really challenging about it, okay? So just follow the light. As you can see, I'm moving it quite slowly so that it's really easy to track it with your eyes. You don't even need to focus that hard. Now I'm gonna move the light a little bit closer and farther from you, so like in and out. And please keep on following it with your eyes, and I'm gonna look at your reaction. Look at the way your eyes react to the light, okay? Good. Wonderful. Once again, in and out. In and out. In and out. Alright, good. Well, just a second. Okay. Good. Alright. Good. So now, could you please look up and down? And now, okay, good. Good. Now to the other side. Okay, wonderful. Good. Once again. And this way. And then up. Then down again. And then up. And then down again. Alright. Wonderful. And now I'd like you to look straight at my nose, okay? So I'm gonna test your peripheral vision. So no cheating. Please keep on looking straight at my nose, alright? So give me a second. I'm just gonna just some more information. Okay. Good. Wonderful. Well, so as I said, please keep looking straight at my nose and let me know when my hands leave your vision, when they disappear from your field of view, okay? Okay, good. Shall we start? Alright, so keep looking straight, my nose, good. Wonderful. Good. Good, Rachel. Good. And yeah, I'm going. Yes, right, yeah. Alright, good. Good. Alright, good. And now please let me know when my hands appear in your vision again. Alright? Good. That's right. Wonderful. Good job. Good. Alright, amazing. That's really, really great. And now please look straight at my nose and let me know how many fingers I'm holding up, okay? Good job. Okay, right, yeah. Wonderful, good. Good. What about now? What about now? What about now? Alright, wonderful. So it's not that easy to confuse you, right? You know exactly what you see. Good. Please tell me, what color is that? Okay, amazing. What about this one? Sure. About this one? Good. Now this. Alright. Wonderful. So we've done some tests related to your color blindness. I hope you had a little bit of rest. And now I'd like to test your vision a little bit more, like in particular your vision acuity, yeah, the ability of your eye to distinguish the objects and their shapes and colors and stuff, especially at a distance. And in this case we need to test each of your eyes at a time. Yeah, so now we'll do some more tests with light and other stuff, but I will ask you to cover one of your eyes, okay? Good. So let's start with this one. Once again, please look at the light. Keep on looking at the light and I will just observe your reactions. Please follow the light for me. Follow the light for me. Alright, amazing. And now please let me know when the light leaves your vision. Okay, I'll just swing it there and back. So just let me know when you can't see the light anymore. Alright, wonderful. And now please let me know how many times you can see the light flash, okay? Please pay attention. You need to tell me exactly how many times you can see the light flash. Not just counting this, how many times I clicked on it, but actually how many flashes you've seen. So how many? Okay, that's quite accurate. It's alright if you miss one, or if you add like one flash, one extra flash, but yeah, like so, like one is fine, but if it's like more, if you're mistaken like more than one time, then that would be a little bit alarming. Well, anyway, you did fine. Alright, and now the other eye, okay? So once again, I'll cover it, and once again, please let me know if you feel comfortable enough and if you can see the light. And once again, just keep on following it, and I will simply test your reaction, and I'm gonna swing it like I did with the other one. So please just let me know when the light leaves your vision. Alright? Okay, good. Good. Okay, and now once again, let me know when the light leaves your vision. Good. Amazing. And once again, let me know how many times you can see these flashes of the light. Good. Alright. Give me a second, please. Good. Fine. You're doing great so far. No worries about that. Alright, so the next one. I guess that it would be actually nice to test your sensation, and for that I have a few different items. So I have this hammer, and as you can see, it has two sides. One is metallic and therefore it's quite cold if you touch it. And the other one is made of some kind of rubber, so it's definitely warmer than this side. Alright, I will touch you in different areas and different parts of your body, and you will simply tell me if it's cold or warm. Alright, so again, I guess that it shouldn't be too hard, but let's see how it goes. Okay, so once again, close your eyes, please. No cheating, and let's do it. Okay, so now, is it actually warm or cold? Okay, wonderful. And what about now? Is it warm or cold? Good. What about now? Warm or cold? Good. And what about now? And what about now? And how does it feel? Alright, and then I'm gonna touch you again. Right on your hand. And on the other hand, that was cold, right? Yeah. Okay, what about now? Yeah, that was warm. And what about now? That was cold again. Okay, wonderful. Good. Well, you're doing great. And now a pretty similar test from the perspective of like touching you with different items, but this time we're gonna see if you can feel how sharp or soft, dull, if you say so, the object is. Okay, well, I have this tool, and it is made for actually testing the sensitivity of your skin. And like, therefore, like the work of your nerves, right? It's not just about like skin sensitivity, but mostly about how your nerves work. Well, and I'm gonna use this as for sharp, which is kind of obvious, and the same red hammer is for dull. All right, so I hope you're ready and we can start. What about now? I'm gonna touch you really slightly, really gently, so no worries, I'm not gonna hurt you. So is it sharp or soft? Alright, right here. Good, it was sharp. Now please close your eyes again. So what about now? Is it sharp or dull? Good, that was dull. Yeah, quite soft. Okay, good. Now please close your eyes again and keep them closed. Okay, we'll try to do it a little bit faster. Good. So what about now? Yeah, that was sharp. What about now? Yeah, that was quite dull. Okay, good. What about now? Okay, that was sharp. Wonderful. And what about now? That was soft. Good. What about now? That was soft. Good. And now? That was sharp. Alright, good. Wow, you see, it looks scarier than it actually feels, so I told you didn't need to worry. And now, since I'm holding this hammer in my hand, I guess we can test your knee jerk and some other reflexes, okay? Good. Well, let's start with your chin. I'm gonna put my fingers on your bottom lip, right under your bottom lip. So please just relax. It's fine, it's not gonna hurt. Okay, good. Wonderful. Now, your wrists. Good. Alright. Wonderful. Your knees. Good job. And now your feet, your ankles. Good. Well, yeah, you almost kicked me, but it's fine. I'm used to that. You see, I have to handle it every single day, well, so it's not a big deal, really. It's fine. As long as everything works, I don't mind being kicked. Alright, just this way. Give me a second. Good. And okay, right there. Alright. Wonderful. Good. Now, another thing, I like to actually inspect your nose and your mouth cavities, your nasal and your mouth cavities a little bit closer. Have a closer look at them, okay? Well, let's start with your nasal cavity. So I'm gonna inspect this inside your nostrils. Please don't worry. As I said, it might be a little bit unpleasant, but it's not gonna actually hurt, right? So it's not really painful, so please just be patient. It's fine. I know it's not like the best feeling, this world, but again, there's nothing really scary or painful, right? Just a little bit pleasant. Okay, as far as I can see, everything is just fine. Okay, good. And now your mouth. So I'm gonna use the spatula. So please don't worry, again it might be a little bit cold, but I guess it shouldn't be a problem. So please open your mouth and say ah, and let me press on your tongue tiny little bit. Okay, so please no worries. I know it's just not very nice, but again I just need to see if everything is alright. Okay, good. Good. Yeah, I see the tongue, the uvula. Okay, you're alright. Okay, good, amazing. So everything is like the way it should be. I mean the color and the like the way the surfaces look, all this mucous membranes and stuff, so everything is alright. And now I'd like to also have a look using this mirror, just a tiny little bit. Again, as I promised, it won't take long, but we still need to do this. Okay, I'm just using this mirror to be able to inspect everything in detail, you know, not to miss anything important, just in case something needs to be treated. But so far it seems really nice. It seems all is good. I told you. Okay, and now let's inspect your ears, and afterwards we'll do a short hearing test, okay? So I'll start with this one. You can just relax. I simply need to have a look. I'll take the mirror again. And what I'm looking at is just the amount of wax and if everything is alright inside the ear canal, and you know, like the size. Again, as I said, if there aren't any wax buildups and anything that could actually make your hearing worse, anything that could bother you. But as far as I can see right now, it's actually alright. The amount of wax is quite normal. There's nothing unusual there. The ear canal seems to be clean and fine. There are no build-ups or something that could make your hearing worse. And so now I suppose we can actually skip to the hearing test itself, right? Well, again, I think that I asked you at the very beginning, but do you have any complaints regarding your hearing? Okay, that sounds good. Wonderful. So let's just test it tiny little bit. So that would be a TuneIn Fork, and you must be already familiar with this tool since you said it's not your first cranial nerve exam. I suppose that you know really well how it works and what to do with it. So once again, I will produce the sound. Not me, like the TuneIn Fork will, but I will make it happen. And I will put the TuneIn Fork a little bit like behind your ears, and you will just let me know when you can't hear the sound anymore, okay? The sound is like specific vibration, okay? So you can close your eyes, you can keep them open, it doesn't matter in this case, really. So let's do it. Okay, so now you cannot hear the sound anymore. Good. What about now? Okay, good. I knew it. Yeah, you did just fine. Alright, and now I'd like to test both of your ears and your ability to detect which side the sound is on. So close your eyes, please, because now it's really important that you close them. And I will just make some sound on either side, and you will simply let me know which side it is, okay? Let's do it. Have you closed your eyes? Okay, I suppose I can trust you. So which side was that? Good. About now? Good. About now? Alright, and now? And a little bit more. And finally the last one. Okay, good. Finally, I'd like to test some more of your reactions and your reflexes. So, could you please raise your eyebrows for me? Yeah, just pretend that you're surprised or something. Now, could you frown? Good. Now, please keep your eyes closed and don't let me open them, okay? So I'll be trying really hard, but keep them closed. Okay. Good. Wonderful. Now, would you please show me the widest smile that you're actually able to show? Okay, just like that. Wonderful. Now please shrug your shoulders, just raise them, and now keep them raised and don't let me put them down, okay? So please resist as hard as you can. Okay, wonderful. Good. And now could you please puff your cheeks like that? Please try not to let me close them. Alright, good. Now I will try to turn your head a little bit, to tilt it a little bit, but I also want you to resist and not let me do that, okay? Good. Alright, and now the other side. Okay, good. So perfect resistance. Alright, I have some good news for you. You are perfectly healthy. All your nerves, all the systems, all the senses work just fine. So yeah, I don't see the need in any further treatment or any further inspection, at least for today. Yeah. But in case you have any complaints or any issues, please don't hesitate to come. Yeah, you can call us, you can make an appointment at any time you need. Sure. Yeah, it's been a pleasure to work with you today. Great. Have a good one. Bye.